Good morning, everyone. Thank you so much for coming. Please feel free to get more coffee whenever you want, and we understand that people will be coming in, even while we're all speaking. But we'd like to start. Greg Sartorius, Senior Editor in Medicine, and myself, Pia Miller, the Director of Health and Hospitals, we'd like to start by just giving you a little bit of history on Springer Nature.
Thank you, Pia. So, Springer Nature have long histories beginning in the 19th century Europe. As investment in science and research grew worldwide in the past 50 years, Springer and Nature expanded their respective presence globally. The growth of technology and new media in the 1990s fostered new innovations within both companies, including Springer Link, our industry-leading online platform, Springer Book Archives, NPG, and our expansive collection of ebooks.
So, we have had a long history, over 170 years on the Springer side and over 150 years on the Nature side, of having responsibility to publish impactful content, having a global presence, as well as partnering with the latest technologies and innovations.
And Springer Nature is diverse brands and imprints such as Nature Partner journals Macmillan Education, Springer Healthcare, ADIS, or Open Access or Biomed Central, and of course Scientific American, demonstrate how Springer Nature is a major force in science publishing, especially medicine.
So as far as having that global presence, as far as impactful content, we have at Springer Nature, since this merger, we have 2,000 journals and nearly 200,000 books. And many of the journals are ISI ranked, and many of the books are duties rated.
And our major databases include Springer Protocols, Nature Protocols, Springer Materials, ADIS Insight. And these databases continue to grow and reach worldwide markets throughout our 60 publishing houses in 20 countries throughout Europe, Asia, and the Americas. Springer Nature was at the forefront of open access, and we are the largest STM open access publisher.
Since the merger, we have had a distinctive competence in many of the areas in medicine. In particular, oncology and hematology is one of these. We go the breadth and depth, end to end at Springer Nature, from the broadest, largest titles like Nature Reviews Clinical Oncology or the AJCC Staging Manual, all the way to having the top niche titles in breast and colon cancer.
And this is aided by our partnerships with leading societies such as the AJCC, the Society of Surgical Oncology. And Springer Nature has over 1,600 ebooks and 200 e-journals that are dedicated just to oncology.
And just one more thing is also we also partner with a lot of humanitarian organizations like Hanari and such to put out content. Although we're here today mainly talking about oncology, one of the latest things that we've put forth is a Zika initiative and made freely available a lot of the latest content we have in that area. Along with that rich history and responsibility, we also have a commitment to the future, and this involves digitizing and making available all of the latest current content that we have, as well as finding and partnering with the latest technologies and solutions to make sure we're always moving forward.
This includes clinical decision support, interactive learning, and effective use of social media and big data. Now I'd like to introduce everyone to our Executive Licensing Manager, James Afalco. James is going to provide a brief demonstration of the Springer Nature platform. James?
Thanks, Greg. Good morning, everyone. Again, thank you for joining us. So I will go through the two platforms. If anyone has any questions afterwards, please feel free to ask me after the session. So as Greg and Pia gave that quick demonstration of what Springer Nature is all about now, I will go through our two platforms. Combined with these two platforms, we have over 2 million resources now dedicated to the oncology area. Here at nature.com, this is our quick overview of the platform. What you'll be able to see is the latest research. You'll be able to explore nature. You'll see special features. What you'll also be able to do is see all of our publications. When we do our publications A to Z list, you'll see that there are, a number of different areas that you can search, different titles you can search on. Within the Nature umbrella, we also have 2 dedicated titles. We have Nature Reviews Cancer, and we have Nature Reviews Clinical Oncology. What you'll also see is on the right-hand side, you can actually browse by subject. When you do that, you'll see that cancer is listed number 1 under clinical practice and research. If you were to click on the cancer, what you'll now get is an overview of what we give. So we give a quick synopsis of cancer, and then we'll show featured articles. There you can actually click these on, and you'll see what the title is, and then you'll be able to see the PDF, the citation, reprints. You also get the rights permission and the article metrics. This is just a quick overview of the Nature platform. On the Springer platform, what we have also is we have 2 different dedicated platforms. The one that you're looking at right now is dedicated to the corporate market. We also have one that's dedicated to the academic market. With the corporate market, we're broken down into different industry sectors, ranging from automotive all the way down to telecommunications. And then on the academic side, we're actually just based on discipline. If you're actually searching in the Springer platform, what you'll be able to see is that you can break it down by journals, protocols, ebooks. We also have a second platform that is dedicated to our ADIS Insight, which is our drug development platform. If we just did a quick search on cancer or oncology, what you'll now see is that we have on the left-hand side the number of different resources, how it's broken down based on article, chapter. You'll see that we have over 11,000 protocols that are dedicated to the oncology industry. You also see we have over 4,200 books and 136 journals. As Greg said, combined we have over 200 journals now between the 2 platforms. And then we have our book series and our reference works. So if you wanted to just see which journals, you'll then see the date that it was published. You can also do based on relevance. If we clicked on Journal of Cancer Research and Oncology, you'll get a description, you'll get the latest articles, you'll see what the impact factor is, and then you can actually view the article as a download or as a PDF, as an HTML. You can also stay up to date with an article abstract by the RSS, and you can register for journal updates. As I said, this was just a very quick synopsis of our 2 platforms, but if you do have any questions, please feel free to ask me after the session.
So now let's move on to our panel. Here to present oncology trends and challenges and Springer Nature's role in the oncology community, Chief Editor of the journal, Nature Reviews in Clinical Oncology, Dr. Lisa Hutchinson.
Welcome, everyone. It's a pleasure to be here today. I was super excited to be part of this panel discussion. I've been the Chief Editor of Nature Reviews Clinical Oncology for 12 years when we launched back in 2004. And I can tell you that actually even ASCO has changed in a decade, let alone the landscape of cancer, how we treat patients, the scientific side, and indeed the publishing side. So essentially, the real issues in oncology are centred really, even this year, the theme is multidisciplinary. If you had to summarise in oncology one word, because of precision medicine, our ability to better stratify patients to what type of treatment they're getting, actually oncologists need to keep up to date with many, many areas, not just within their own individual fields. So essentially, we know that one of the biggest burdens healthcare-wise is that our life expectancy, whilst on the plus side is increasing, so even people that were born in sort of 29 countries in 2015 are considered to now have an average life of 80 years. There are many, many countries, low middle income, and even actually some high income countries where nonetheless, a lot of patients are actually below 60 years in terms of their life expectancy because of comorbidities and chronic diseases such as diabetes, cardiovascular and cancer. In fact, I attended a session on Friday afternoon that was essentially on sustainable care in cancer, and David Kerr did a talk. He's from Oxford, and he commented that the male average life expectancy in Scotland is only 53 years. Perhaps the fried Mars bars they eat don't help, but just kidding. So we know that the leading cause of death in the USA, 600,000 deaths, is due to cancer, and that the burden is increasing substantially. So by 2030, we're expecting to get 2.3 million people dying from this disease. And things like unwarranted variation in cancer survival. So how is survival being affected by factors that are to some extent outside our control in terms of how we do our studies? So what are the key challenges? Well, I would say, and this is by no means exhaustive, we have, as we know, regardless of whether you're in the UK, whether you're in Europe, Africa, Middle East, North America, unsustainable healthcare systems. And in addition to that, we've got economic and societal barriers. So a lot of patients, 97% of patients with cancer do not enter or get enrolled on a clinical trial. So all the data, the vast data that we have, is only from 3% of patients. Not to mention, of course, that with different sort of insurance coverage, single payer models or co-pay models, the different ways in which we fund our healthcare systems across the globe is providing a real challenge in cancer where it's such a complicated disease. And I would argue that the other issue here is that we've got a very cluttered landscape, literature-wise. I mean, in 10 years, the publishing landscape has increased enormously, almost exponentially. There are 4,000 manuscripts published in Science, Technical, Medical, or STM publishing on a weekly basis. How on earth is an oncologist or research scientist meant to keep up to date with the rapidity of these changes, and also the scalability? Big data, all the genomics, or proteomic, omic technologies means that actually understanding how all of these interrelate with each other is really a very, very difficult thing. So staying up to date with the latest advances, especially in a multidisciplinary audience or field, is the absolute issue where Springer Nature, I think, has a role in tackling potentially oncology. So through our STM offering, I mean, obviously we've alluded to in other presentations, we've got the Nature platform. And what we've done is consolidated all the Nature branded journals, whether it's Nature research journals like Nature Genetics, Nature Medicine, Nature, as well as all the Nature review titles, of which there's now 18. They're all under one portfolio now termed Nature Research. But in addition, the Springer part of our now merged company also, of course, has a massive portfolio of book publishing, as we've learnt, over 200,000. Not to mention, of course, we've also got Palgrave education books, and of course Scientific American. So we're also having across the breadth of our audience, not just for specialists but for non-specialists as well. The other thing that actually our editor-in-chief, Phil Campbell at Nature, is interested in is looking at sustainable development goals. So if you look at the WHO, there are 17 of these in terms of tackling poverty, in terms of sustainability for energy, for water, and obviously healthcare is right up there. So our medical journals really play a role in this. And we've also started to look at grand or societal grand challenges as well. There's an interesting project that's just being in the beta phase that we're doing called Up to Date. So how is, as I say, a busy clinician or research scientist expected to keep up to date with their work? What we're trying to do is we're trying to learn from our customers and actually make our content across the whole range of all our journals more discoverable for our research and clinical scientists. And so what we're doing is we're looking and seeing what parts of the websites our users are using, and we're offering them up content from our portfolio of Springer Nature journals that they might not otherwise have come across, and seeing how they're now sort of accessing the sites and jumping between different areas so that we can also give them a more precision type or personalised offering in terms of what they want to read, which we hope will also reduce silos and increase education. So the key here, this slide is very, very crowded, but essentially we're serving all stakeholders, research scientists for all our Nature platform journals and indeed Springer academic journals and titles, clinicians, funders, all of MRC and CR UK, to name a few in the UK, corporations as well, and regulators, FDA, EMA, are very much needing to keep up to date with the latest advances on treatment and diagnosis and other elements. Librarians, of course, authors and reviewers. There's also pharma and biotech, and not to forget insurance companies. And let's not remember, patients and the public at the heart of this. So I commented earlier how Scientific American is also helping to serve perhaps the more non-specialist audience. So we have a multi-platform that is vast and covers all clinical life science, physical sciences and social sciences as well, and humanities. So we have basically a multi-branded, customer-obsessed, data-driven portfolio of journals that is trying to provide all our readership with the highest quality research and clinical titles and educational services. So this is just a quick screenshot here of the Nature conferences. So Nature actually organise independently because they're editorially independent. They do have sometimes links with societies, but they organise Nature-branded conferences. This is part of our brand. And this is just a screenshot here. And we actually recently had one just earlier this month in Madrid. So we were looking at familial cancer genetics. We worked with our collaborator, European School of Oncology and CNIO, to actually tackle some of the things like moderate penetrance genes, high penetrance genes across prostate cancer, across sarcomas, as well as breast and ovarian. And this is just recent coverage, because I talked earlier about health policy and some of the sort of more, issues that are outside mainstream clinic and science. So overcoming barriers to how we participate in trials, or how do you put a cost on cancer? These are certainly topics that we're covering avidly in the journal, both in commentary format and in our reviews and perspectives. And here's again another screenshot here of an article that we published just last year, commenting on how do we get equal access to innovative therapies. A lot of these fancy targeted drugs that are very expensive are often actually not available to patients if they're not treated within the manufacturer's label. So we now want patients through their molecular profiling and genetic sort of unique tumour subtypes to be able to get access to drugs they wouldn't otherwise done. And this is a summary of an initiative that's taking place in France. And there's other ones, as we know, that are going on in America. And so I'll leave now to my co-presenter.
Thank you, Dr. Hutchinson. Our next panelist is the Medical Director, Chairman, and Professor of the Department of Pathology and Laboratory Medicine at the Cedars-Sinai Medical Center in Los Angeles. He is also the Editor-in-Chief of the 8th edition to the AJCC Cancer Staging Manual. Please welcome Dr. Mahul Amin.
Thank you, Greg. So good morning, everyone. Thank you for coming. I wanted to take this opportunity to briefly provide you with a snapshot of about 3 years of work and what has gone into the development of the next AJCC TNM staging manual. And from a broad perspective of some of the developments, you'll see throughout the book a flavor, and including in the preface, that we label this edition as the bridge from a more population-based approach to a more personalized or precision approach. And I'll kind of go through that concept as we speak more about it. So the reason why there's interest, and I just noted here that Springer had over 100,000 products related to the 7th edition, is because the AJCC and the staging system is widely used as the format to communicate a standardized nomenclature for cancer. It's really very well integrated into clinical practice in terms of the staging, the prognosis, and making treatment recommendations based on the paradigms that are created from the stage of the disease, from the perspectives of clinical trial, research at all levels. Stage does form the basis of a lot of cancer management. And from a population base, the sort of way staging evolved was to study longitudinal cancer incidence, to study the change in the spectrum of disease, to look at efficacy and quality of care. So we want to keep that basis of understanding cancer in populations, but take it to a more personalized level, and that's sort of the focus of what we're trying to continue to do with each edition as we evolve. And so as was mentioned both by Pia and Lisa, the landscape of cancer has just dramatically changed in the last 10 years. And so when we are looking at the staging system in 2016, and the last one was in 2010, of course, there have been dramatic changes in the field of cancer. The advances in molecular underpinnings is just a small one blip here, but just I was baffled to see the 1,000 papers a day. That contributes to all of this. And just understanding of the oncogenesis, the progression, resistance, high throughput testing, the informatics and computational biology, cancer care that is really coordinated through team science. And so we wanted to make sure that this edition is truly a team science, and that beyond surgical oncologists, there have been medical oncologists, pathologists, imaging, public health, and computational biology people and biostatistics folks who have really helped in developing this next phase of the manual, of the staging manual. Data is now becoming available as we speak, so our focus as we go in future is to make these more iterative, the changes in the staging. As you all know, the advances in therapies continue, and globalization of cancer is clearly here. And so the intent here is to therefore, in the staging, to have that one system that provides a nomenclature and a platform to communicate about cancer. So what was the driver behind these 3 years of work? We created panels for the disease sites. These panels were constituted by about 420 individuals from 5 continents, 22 countries, and 184 institutions worldwide. There were 7 cores that functioned across these different sites of breast and GU and lung, et cetera, that helped sort of in some of the very basic aspects to support staging. We had very important partnerships with organizations. And so as we sort of embarked on the development of the 8th edition, one of the issues that is well understood with TNM, and was certainly there when we started this, is the feeling that TNM does not meet the needs of the clinicians and patients from an individual basis. It does not help in predicting value of therapy, again, at a patient level. And so there's this constant fear that maybe TNM risks marginalization, maybe because it's not as appropriate. And because TNM is largely limited to anatomic information, it really lacks biologic data and creates bins of patients. So in developing this 8th edition, we've been very mindful that we want to keep that anatomic basis of the TNM, which has been the hallmark of the TNM system since the 1970s, to look at the longitudinal changes and worldwide use. But more importantly, we wanted to sort of move into 2016 and beyond. And so this chart should sort of help you understand our vision beyond our vision in this 8th edition. So the AJCC and the UICC partner in coming up with the TNM. This is largely produced by those 420 experts. That is the TNM, the anatomic basis of disease. Now, AJCC has embarked very clearly, and here is where we differ a little from the UICC, is that within the stage groups, we have now included prognostic factors, Gleason score, which is now called prognostic grade groups, ER, PR, HER2, and those are now part of stage groups. And so we have the TNM and we have what we call AJCC prognostic stage groups. And to take this to a more personalized or precision medicine level, in each of these chapters, there are concepts of risk assessment models and clinical trial stratification. And so you can see that we will maintain the population survival outcome basis of the TNM, but really we are moving this more and more towards a more personalized basis, but give both the perspectives for the cancer patient and physician. Also, what is very important is that we've focused a lot on content harmonization across all chapters as these have matured and there are so many people working on it. We want to make sure that all this information is interoperable. So there's a lot of effort that's gone into content harmonization such that all this information can be directly transported into electronic health products. And we're working with Springer on the content management system product, which is basically therefore taking the AJCC content and then depending on where we need that data to be able to transport it. So another way to look at it is all the expert panelists have done their work in a Word document. Now all of this is now given over to Springer and is transported into a system called an application programming interface that takes all this information, and from that we can develop several products that support the AJCC TNM. So this is a huge effort on behalf of the AJCC, a lot of expense, but basically takes a single source of content and be able to use that same material for different uses in cancer and serve the different stakeholders that we've talked about. Some new features in the 8th edition. We are very transparent about the levels of evidence when we change staging systems to provide you what was the level of evidence. There's a lot of focus on imaging. This was not there in prior editions. Risk assessment models, as I talked about in clinical trials, and prognostic factors. Really, that journey from that population base to that precision medicine is a very important feature in the new edition. We update, as with all staging manuals, the general staging rules. We have updated staging systems. There are 12 new chapters in staging systems. Some of the chapters have been reorganized, some are merged, some are deleted. Of course, with the staging, we update the histologic classification, the ICD-10 codes, etc. And in this edition, there are definitely many more illustrations and much more of a single comprehensive package. Just to give you a flavor of the high-level changes, again, there are just multitude of changes, and each chapter has, at the beginning, a summary of changes. But to even give you a sort of 35,000-foot level change, we're now talking about staging cancer based on disease status. So oropharyngeal cancer would be now staged based on, does the patient have HPV or not? And if you have that, then there's a completely, depending on HPV positive or negative, completely different staging system. So not only based on anatomic, where the cancer is, but really what type of cancer. There are separate staging systems now based on patients for neoadjuvant therapy alone. So we're not starting with the traditional paradigm of the clinical stage. And for bone and soft tissue sarcomas, et cetera, we have really split them into rather than a global staging for bone and soft tissue sarcoma. So these are some of the new high-level changes that we have. This work is, as I said, intended to be iterative, and we'll be working with Springer and the AJCC. We'll be having all this information on its website, www.cancerstaging.org. The 8th edition content will be available through, again, I think you should contact Springer in terms of the EHR vendors and sort of if you want access to the API or how you get access to the books and the staging forms, et cetera. And the intent is that this staging manual will be released in sometime mid to late October. The full-size manual. This manual promises to be at least twice the size of the last edition, and it doesn't have the staging form, so you'll see there's a lot of content. It's very rich in content. The 8th edition will go into clinical use on January 2017, and again, we've talked about the availability of the 8th edition content. So with that, this is a brief overview, but I'm really happy to represent over those 450 people who have given their volunteer time in making this very exciting change for cancer. Thank you.
Thank you so much, Dr. Amin. Our final panelist is a nationally renowned oncologist and a longtime publishing partner of Springer. He's president of the Cancer Treatment Centers of America's Medicine and Science Unit, editor-in-chief of Current Oncology Reports, series editor of Current Clinical Oncology, and the volume editor of the highly successful Atlas of Cancer. Dr. Maurie Markman.
I don't have any slides. My comments are going to be brief because we want to bring you into this. And I think I'm up here because of the sort of the, I would say age, but let's just call it experience, or perspective. I've actually had the opportunity, the pleasure, the privilege of working with Springer for now more than 30 years. Actually, in my second faculty job at Memorial Sloan Kettering, I was asked to become an associate editor for the Journal of Cancer Research and Clinical Oncology. You'd say that is a very old journal, so that the fact that I was doing it for 30 years, that's just a drop in the bucket for this journal's history. And then I had the opportunity to get involved, and obviously I've been involved in some of the book projects, but the Atlas of Oncology, which was it is a very extraordinary opportunity, and now an entirely online journal with Springer. And I have been incredibly impressed with the organization. And then when I heard that Springer and Nature were now together, my first thoughts were, this is just unbelievable. because obviously I have a little interaction with Nature, having been a reviewer, and even a little bit of writing as authors, but everybody knows Nature. I mean, everybody knows Nature because they know Watson and Crick. I get Nature every week, and I laugh about it because, you know, maybe a quarter of the articles I can even read the abstract and understand. And then it's, you know, the cosmos and all the way down to the gene and everything in between, and the news content, and of course the wonderful review articles that are part of Nature. And that's now all part of this new entity. And of course, I cannot stand up here and not mention Scientific American, because I've received Scientific American in my household since the age of 10, because that was my parents got it for me for my birthday, and I've read it since then. Again, a lot of the content I don't quite understand, but it's always been designed as the highest quality, and is the highest quality lay scientific publication, journal, call it whatever you want. And that's now all part of this enterprise. And the only other sort of the general comment I'll make is, again, having worked with Springer for so long, I've been reflecting on that history, and I vividly remember that, and I'm sure nobody with Springer is still around these days, but when, as an associate editor, they'd ask me to keep track of the number of articles I had reviewed in the year, because they didn't actually have any ability to kind of keep track themselves. So they wanted to know, well, how many articles did you review this last year? No, that was 30 years ago. To where we are now, where of course we have, you know, routine online journals, and one of the really exciting parts about that, and one of the journals I'm editing with them, is we don't even have to worry if the we don't have to worry if the authors get their content on time, because it's there or not. You can put it online and have it there, and eventually, if that author finally gets his or her article, his article, and on time, we can add it. And the whole publishing world has changed, and it's very exciting. And that's a nice sort of background. But the real point of what I would like to say, and obviously would like to bring everybody in, is the future, because as noted, this meeting and future meetings, but let's focus on this meeting. The content is beyond comprehension in terms of the ability to absorb it, to understand it, to assimilate it, and then to walk out of here, and what do you do next? And I can assure you, next year, 6 months from now, it will only grow. And I don't mean double, triple, I mean exponential growth or greater. And so this concept of decision support, which is, you know, kind of nice words, 2 words, decision support, but decision support not only for the clinicians, but again, going back to Scientific American and the opportunity of bringing the public in on this journey with us that is incredibly exciting in cancer, but incredibly difficult, complex, and I have to mention the economics in all of this. And again, we're talking about Springer Nature and their opportunity to play a role in this entire process, from the scientific review / quality, the best there, at a more of a basic level, to, you know, getting it down to the clinical level, to the what does the clinician, and that is very broad based. That goes all the way, obviously, from the expert oncologist at an academic medical center to the oncologist caring for that individual patient in her or his office, all the way to the public at the highest quality and understandable, and it changes all the time. Again, it's this platform that's being put together. What can they do? What should they do? How have they done? So with that, as a few introductory words, I'd like to, as the moderator, you know, now turn it to you for the few minutes we have. And first I will ask my co-panelists, how do you think Springer Nature is doing, and what do you see the future of the platform for the future? And then it's open. I would like to have a conversation in the minutes we have, because those of you who've been invited have a relationship, Springer Nature, or have an interest in what's going on here. So, you know, the Springer Nature people who are here, they're listening, they would like to know your thoughts. General comments.
Thank you. I can perhaps speak first of all to that particular comment, because
when we launched the journal Nature Reviews Clinical Oncology, actually the publisher at the time felt that the reason why we needed the journal, why do we need another journal, was the first question of the editorial that was written in the launch issue. You know, we've already got a fairly heavily crowded landscape in oncology. What sort of purpose does Nature Reviews Clinical Oncology serve as a secondary journal? It doesn't publish primary research content. Well, the answer to that question is busy clinicians. The biggest problem they have is time, or rather lack of time. They haven't got the ability to stay up to date with all the latest information. As we know, the publishing literature is growing fastly. So therefore, our journal was created to try and filter some of the enormous amount of research and clinical trial data that's out there and put that into context by having expert commentaries and review articles so that people can be sort of up to date with their daily sort of clinical research activities. And so 12 years on, we hope that that journal is still achieving that kind of mission. But just to draw back to cancer, I mean, I kind of wrote a little slide here, which wasn't presented, but I termed it a mission statement. The extraordinary science and technical and online advances in basic cancer research, coupled with our increased knowledge of the normal as well as the cancer genome, has fundamentally changed our understanding of the multitude of diseases that we call cancer at every level. And we're talking about here diagnosis, screening, prognosis, treatment, clinical trial design, and patient stratification, among the many. And the pace and scale of these advances, coupled with societal and economical challenges, has a more profound influence on cancer than probably any other therapeutic area. So the idea here with Springer Nature and this unified platform is that the only way that clinicians and research scientists and funders, authors and reviewers are going to stay up to date and understand how the cancer is not only changing, but how our response to that is changing, is to have a publishing landscape that's unified, multi-branded, trustworthy, which is certainly what all of our brands do. And then we are hoping that we can also not only be reactive to the literature, but proactive. So we might create new journals, launch new initiatives within our platform, whether it's extra conferences, educational services, to serve our community better and more broadly than we currently do when we work in not a unified partnership. I hope that goes some way to answering that question.
So, and something just to stimulate conversation is, as I mentioned, the 8th edition is almost twice or 2.5 times the scope of the previous edition. And there's sort of two aspects. One is, of course, to take this content and take it to the point of care, to be able to have it at the bedside, or to have the information on apps that you can have. So that we'd like sort of input from that perspective. But more interestingly, we've been toying with the concept and we haven't yet completely flushed it out. But beyond the manual, we'd like to understand if there's interest in subspecialty units. For example, if this entire manual is 1,500 pages, but if someone is practicing, say, bone and soft tissue sarcoma, would you be, what's the value of having the 1,500 page book? Why not have a 80-page book that has just that? Or if you're practicing GY and oncology, there are about 8 or 12 relevant chapters, and so why not have those sub-books? But you'd be interested to see if there's, from your perspective of being in the place you are and your interest, as to what's the viability and feedback on those kind of products. That would be interesting.
So the two questions, again, how are they doing? How are we doing? How are they doing? However you want to look at it. And what are your suggestions for the future? You may know a lot more about the Springer Nature platform before you walked in here. If you were like me, you heard about it for the first time when I received the call asking me to participate. But what you've heard, what are your thoughts? Where might this organization go? Unmet needs, opportunities, and your own experiences. Comments, questions?
Hi, my name is Amin. I'm the Executive Director of the Society of Surgical Oncology, and our journal is published currently by Springer Nature. I very much appreciated the presentation, and I think that from my perspective is how do you leverage the relationships with the professional societies, because they can be a very positive conduit to the practitioners in terms of information. And in light of our relationship with Springer Nature, we have not yet had a conversation around this platform and how we might contribute to dissemination of information. And likewise with the AJCC, I very much appreciated your presentation and would like to have conversations offline.
Those are good questions. I will, again, we haven't rehearsed this. Comments from anyone actually in Springer Nature about, again, you're already having a tremendous relationship with the various societies, how to potentially engage them even more, and particularly about the opportunities with the new platform. Any comments or no comments, sir?
So, I'm a general med onc. I would practice in Baltimore, and I would say from my perspective, it's hard to carry around that book when I go from patient to patient. It'll be nice to have, instead of a 1,500-page book, a concise chart. Potentially, the charts that you have currently are a little bit technical. From a patient perspective, it'll be nice to have a chart that's easy for a patient to understand in terms of staging. For the big cancers, breast, colon, lung, potentially that would be helpful, though, from a patient perspective, for education purposes.
Sure, so we'll factor that in. Just to give you some idea, one of the most complex charts is the breast cancer. It used to be just the TNM, now it's a 3-page with the ER, PR, HER2, and the grade, and how it completely changes the subgroups. So just, in the past you could pretty much say, oh, this is you had this information, say this is a stage 3B. It's not going to be possible in some of these cancers, so we're thinking about it. And it's the fine line we walk between practicality and really getting precise information that's important for management. So yes, that is our concern, so your feedback is valuable to us as to how do we take this content and make it more applicable at the point of care. So apps and those kind of products, and maybe a link where you can just have some information where you just download that site on an iPad or some sort of app, and we'll talk. Just bring that up. But that's,
You've asked a really important question, and I would also say that actually our readers and our users of our journals have very vast preferences. So there are still some clinicians that prefer to read the print copy of our journal and a lot of the nature journals because they can take on a train or a plane or whatever when they're busy travelling, rather than if they happen to have an app that allows them to access some of the latest content online. But the other point that we should mention is that, first of all, we are actually the largest open access publisher as a result of this merger. So Biomed Central, Nature Communications, among many other journals that are published by Springer Nature. And a lot of our open access content is online only as well, or at least online offering predominantly. But the point about the AJCC staging is that we were actually just talking before this panel discussion, we were absolutely saying we need to have ways in which we can offer, rather than 150 pages of the technical text, maybe we could do a summary in our journal. So we definitely have a role in being able to put that out there, and we can make some of our content, and we do, actually open access, even though it's a subscription-based journal. So these are the things that we're looking at. And in terms of the earlier question, the societies, so we actually do have a collaboration with the European Society of Oncology, ESO, and there's also a lot of breadth of academic journals that are society-based, which are Journal of Cancer, European Journal of Cancer, many others that are published by Springer Nature. So we already have relationships with some societies, but I take your point that there are still areas in which we can have a better educational outlet. So I think that collaboration, multidisciplinary, are the two key words in not just oncology, but in publishing.
Yeah, maybe it's a bias because of working in tumor immunotherapy, but things get outdated very, very fast. So you have to implement in any of these publications, particularly if online, the way to update it as it goes. And on the other hand, the best thing in this idea of the iPad, it would be that you can do 7 clicks and go to the primary source of information. For Springer Nature as a merger, that's probably 50% of the relevant information within the realm. So that could be extremely useful. I actually fear my residents carrying this thing around and knowing more than I do.
So other comments?
Good morning. I apologize for arriving, but your presentation has been wonderful. I'm a radiation oncology resident final year, and I'm so happy to be in this room because for us, the manual is very important, but we in the 21st century, I would really echo those sentiments, especially if you're in front of the patient and you pick up the book, you're looking and scrolling, and they know you're resident, they start not trusting you completely, like she doesn't know what she's doing. So it would be nice to have my iPad, I'm in the middle of the clinic, I'm just flipping through, that's how it is, and we really, really appreciate that. I'm in South Africa, and for us, it's very difficult to access the knowledge of oncology and the distribution of all the information. So we really appreciate if it's online and we can access it. I know maybe the problem will be the sale value. How would you be able to sell it if it's online? That's the first question, the comment. The second comment is on the issue of journal article. We have a problem in knowing which one can I quote. I'm in an exam and I'm being asked a question, and I mentioned a phase 3 study, and how do you know this is the valuable one? I would like to know, this is the journal, the Springer is the one, because sometimes there's Lancet, there's Annals Oncology, there's so many journal articles, but how do I know this Springer has the most legitimate authors, and these are the authors I can quote in an exam without being embarrassed? I'm doing my finals. Honestly, I'm reading almost every single journal because I want to ace the exam. But how do I impress my examiner and be like, wow, that's the latest research? Because I don't know if I should quote the one on Annals or make me stay in your journal. Convince me.
You have expressed that as beautifully as I've ever heard it. Thank you. That is wonderful. And that's a very nice way to talk about, quality. And actually, I made a comment. Obviously, I'm old is often good. Venerable is probably better. And I think, Springer Nature, their name stands for itself. But the point is that obviously relates. I'd ask my colleagues to comment about the quality of the review process, the quality of the independence of the editors, the ability to not be influenced, but yet to be influenced correctly, because in fact there is something innovative. And by the way, somebody is breaking the trend, setting a new paradigm, and you know what? Don't say it's not the way we've always thought and therefore it's not right. On the other hand, just because something is new doesn't make it better. And it's very tricky. And I just a general comment is that the reputation of the organization, the reputation again, the independence of the editors, I think Springer Nature speaks for itself. But your comment about okay, now let's get down to the individual patient. Your point, let's get down to the individual test of the examiner. What is the best quality today? Now, it may change tomorrow. Recognize there'll be maybe that new paper that's going to be presented at 9 o'clock this morning. But the fact is, and even then, that's preliminary. It's not peer reviewed yet. And how do we stay up with it? This is really important comments.
Yeah, I'll echo Maurie's comments, which is that we know that as a high sort of prestige publisher, that one of the enormous challenges that lie ahead actually is the technological platform that we host all of our journals and book publishing on. We're trying to provide a unified platform that allows, for example, when someone registers, they don't have to re-register 6 times. They'll only have to do the registration once, and that information is captured, and then they don't have to do it multiple times just because they're trying to access another journal that's part of the portfolio of the Springer Nature platform. But we're also looking at how we can be better informed on keeping our readers and our customers up to date, which is that project that I mentioned, by their browsing and their sort of, interest habits, if you like, how multidisciplinary or otherwise they are going with their sort of reading. And so we're trying to look at ways we can better serve our customers. And, you commented about keeping up to date with Lancet articles or Annals Oncology. These are really good journals as well, so it's not that Springer Nature is the only place to go to, but we think that where we have potentially an advantage is that because we have this unified one single platform but with multiple brand identities, and serving the whole range of customers, looking very broadly at Scientific American. Then you've got the research scientists, the funders with nature journals. Now we have a more powerful way of being able to offer content and make it more accessible and discoverable, where we're using different business models for maybe launching and running some of these journals, but in a way that we hope is going to meet our customers better. So that, I think, is where the strength lies in the next 5-10 years for how we as a publisher rise to that change.
Good morning, Jürgen from Germany. Just a small comment. You're doing a fascinating job, but please, I get a bit nervous about hearing that you want to be proactive. So please think twice. Don't put another journal on the market. We'll already get suffocated by the amount of literature. I could easily spend the whole day reading articles, not seeing a single headshot. Please, concentrate on the important things.
When I said proactive, what I mean is our review journal in particular, because we're not publishing primary content, what our job is to make sure that our readers are up to date and also aware of maybe underrepresented areas in the literature because they're not as trendy or fast moving. Those areas are just as important. So we have an obligation to our readers, and that's what we try and do. We're not overly selective. We don't just say, oh, we'll only cover prostate, lung, breast, colorectal on our journal. We still cover the rare disease subtypes there, or areas of staging and diagnosis and prevention and screening. Things that might not be quite as popular in the mainstream, but they're still vital and important to oncology. And sometimes we can actually create or make aware to our readers of debates that need to be addressed, or certain areas through perspective articles. So kind of that is what I was getting at with proactive, in the sense that we're trying to make our content, with the expertise of the staff that work on the journal, where we are constantly reading literature. There's 3 on the journal, there's myself, 2 associate editors, and we literally scan 4,000 abstracts every month to identify the top papers we want to cover on the journal as research highlights, news and views. Literally 250, 300 a week. So we now have a quite broad overview over 70, 80 journals of what's coming out in the literature and how we can best serve our readers. So that's what I meant by being proactive.
So.
Hi, my name is Ed Salsville from University of Maryland. I have the privilege of co-editing cancer chemotherapy pharmacology, and I think a major issue that where we are in the field is that we frequently get back printouts of mutational drivers, changes that have been brought to us by patients when they get their report from sometimes things they send out themselves. And the meaning of those changes is really opaque. You, with your platform and number of journals, could conceivably create a situation where, for the busy clinician again, who's not going to wade through articles, but so what does having mutated cells mean? What's the evidence that it makes a difference? And that's a different kind of search engine. It's a different type of, it almost might call you to make commentators, sort of commentary. But I think that's the sort of thing that many of us feel is going to important in the coming age.
Fantastic comment. Any other comments? We're almost at the end of our time. Sir, I'm sorry, you did have another comment.
One quick thing from a practicing hematologist oncologist is I would also like Springer Nature to have webinars or more live sessions at national meetings or at the regional meetings for education regarding staging as well. I feel like the website that you have currently does not address that. I see there are a few webinars, but I don't think there's enough.
There are webinars actually, but you're right, they're probably not as they're a bit obscure on the websites. Actually, the reason I know we do them is because through our collaboration with the European School of Oncology, every week I update our homepage on Thursday to announce the fact that there's e-ground rounds, live sessions that are organised by the European School of Oncology to do staging or the latest update from a meeting, where they actually have a discussant, a presenter, and then a co-discussant that talks through, and you can register for free online, listen and tune in real time to those webinars, and then pose a question that the discussant then asks the speaker. It's a 45-minute to an hour session that takes place between 5:15 and 6 o'clock UK time every Thursday. So we've been running that ever since 2008. And it's actually something that we're trying to further promote through the European School of Oncology. That's just one example from my own personal experience on the journal.
But I just see the point that whenever there's a new staging system, we are thinking about how we need to bring in, at least for the more common cancers, some educational.
to look
It's
at.
very important, I mean, because obviously that, clearly the web, whether it's interactive, immediate, but considering the world, it's impossible to do it immediate, but it's available when you want it the next day, the next week. May not be live, but it'll be close. And there's no reason whatsoever that can't, that's got to be the future. I mean, this meeting, for example, will be all online, the scientific content. That's very powerful, but obviously that's great. It happened today. What about tomorrow? Things change tomorrow. That's a great opportunity, absolutely.
It is. I mean, all the questions you've asked are absolutely key and vital. And as publishers, we have to respond to this. And I think, again, it's an up-to-date project. We're not just talking about maybe keeping our readers up to date with the regular, typical article, whether it's a research article or commentary. There's no reason why that project couldn't be offering up, have you seen the latest webinar or latest online audio-visual session on X, Y, Z? So I see huge potential in this project, which, as I said, at the moment is in its beta phase, but this is another way in which people might be made more aware of online initiatives that they otherwise might have missed.
Great.
Also, I just wanted to say that obviously here at Springer Nature, we're listening to all of the comments that you've made, and they're duly noted. And so we'll be addressing them, and hopefully you'll see very soon a lot of these changes or recommendations instituted, hopefully very soon.
Thank you all very much for being here. Thank you to our panelists and our moderator for leading the session today. And we offer any feedback or any questions at the end of this panel as well. Thank you so much.
Thank you.